Let me ask you something most men are afraid to admit. How hard is hard enough? When you're lying there with your partner and things aren't quite as rigid as they used to be, does it matter? Are you overthinking it? Is she noticing? And more importantly, when does not quite as hard become actual erectile dysfunction? When you're stressed about your hardness, you're not in the moment. You're in your head, analyzing, worrying, wondering if this is the time it's going to fail completely. And that stress, it makes everything worse. I'm Dr. Victoria Lee, and today I'm answering the question most men are too embarrassed to ask their doctor. Does hardness really matter? What's the actual medical standard? And when should you be concerned? Because here's the truth. There's a scoring system doctors use, and most men have no idea it exists. In clinical studies, we use something called the erectile hardness score. It runs from 1 to 4, and it's surprisingly simple. Grade 1, not hard enough to penetrate. You might feel some firmness, but it's not functional for intercourse. Grade 2, hard enough for penetration, but not completely rigid. You can have sex, but it doesn't feel as firm as you'd like. Grade 3, hard enough for intercourse and mostly rigid. This is where most men over 50 land. Functional, reliable, but not rock solid. Grade 4, completely rigid and hard. This is peak performance. The kind of firmness you remember from your 20s and 30s. Now here's the thing. This scale is subjective. Only you know what your hardest erection has ever been. Your doctor can't measure it with a device in the office and give you a number. It's about how you feel compared to your baseline. Most urologists care about one question. Is it hard enough for intercourse? If yes, technically, you're functional. But I understand that men want more than functional. You want confident, powerful, reliable. And honestly, partners rarely complain about grade 3 versus grade 4. What they notice is consistency, confidence, and connection. If you're anxious, distracted, or constantly worried about firmness, that affects intimacy far more than a slight difference in rigidity. There's also a formal questionnaire we use to diagnose erectile dysfunction. It's about 5 questions. How often do you get erections firm enough for sex? How confident are you in your ability to get hard? Based on your answers, you get a score that determines severity. No ED, mild, moderate, or severe. But here's what really matters. Technical scores are just tools. What matters is whether you and your partner are satisfied. If you're happy, the score is irrelevant. If you're not, then we need to figure out why. So when does slightly softer become a real issue? When it starts affecting your quality of life. When you're avoiding intimacy because you're worried about performance. When you're so focused on hardness that you're not enjoying the experience. That's when softer erections stop being a mild inconvenience and start being erectile dysfunction. Here's what most men don't realize. Sexual dysfunction always has a psychological component. Always. Even if the root cause is physical, blood flow issue, nerve damage, low testosterone. The moment you notice it, stress kicks in. You start thinking about it, worrying about it. And that worry creates a vicious cycle. Stress tightens blood vessels. Tightened vessels reduce blood flow. Reduced blood flow makes erections weaker. Weaker erections increase stress. The cycle feeds itself. And when you're in that cycle, you're not present during intimacy. You're not feeling pleasure. You're monitoring your performance like a referee watching a game. And your partner feels it. They sense the distance, the distraction, the anxiety. This is why I recommend every man dealing with erectile issues, even mild ones, talk to a sex therapist or psychologist with expertise in sexual health. Not because it's all in your head, but because the psychological component is real and powerful, and addressing it makes everything else easier. Now, from a medical standpoint, softer erections can signal 3 underlying problems. Blood flow issues, meaning your arteries aren't delivering enough blood to fill the erectile chambers. Nerve dysfunction, meaning the signals from your brain to your penis aren't transmitting clearly. Or hormonal imbalance, usually low testosterone, which reduces both desire and the physical response. If you're noticing a decline, don't ignore it. Erectile function is a biomarker for cardiovascular health. If blood isn't reaching your penis, it might not be reaching your heart or brain efficiently either. Now let's talk about something that catches a lot of men off guard: medications, specifically antidepressants like SSRIs. If you're on one, there's a good chance it's affecting your erections, and you might not have connected the dots. SSRIs can cause sexual dysfunction in multiple ways. They lower libido, meaning you don't feel desire as strongly. They affect ejaculation, causing delays or difficulty finishing. And yes, they can soften erections, making it harder to get fully rigid or stay hard during sex. The tricky part? It's dose dependent. Some men notice zero issues on a lower dose, but experience major dysfunction when the dose increases. Others feel it immediately, even on the starter dose. Here's what you need to know. Your doctor, whether it's your psychiatrist or primary care physician, already knows SSRIs cause sexual side effects. This isn't a surprise to them. But they might not ask you about it unless you bring it up. So if you've noticed changes since starting an antidepressant, speak up. Tell them. Be direct. Since I started this medication, my erections aren't as strong, or I'm having trouble finishing during sex. Your doctor can adjust the dose or switch you to an alternative with fewer sexual side effects. There are other antidepressants with lower rates of sexual dysfunction. Bupropion, for example, is often used specifically because it doesn't typically cause these issues. Mirtazapine is another option. The key is finding the balance between managing your mental health and maintaining your sexual function. And here's the reality: you can't ignore either one. Depression destroys libido and performance just as much as medication side effects do. So the goal isn't to stop treatment, it's to find the right treatment that supports both your mental and sexual health. Don't suffer in silence. Advocate for yourself. Your doctors want you to have a good quality of life in all areas, including the bedroom. Here's something most men struggle with. When you're dealing with erectile dysfunction, you're often juggling multiple doctors: your primary care physician, a urologist, maybe a psychiatrist or therapist, maybe a cardiologist if there are heart concerns. And here's the problem. These doctors don't always talk to each other unless you make it happen. So let me give you the most important piece of advice I can offer. You are your own quarterback. You are the coordinator of your health, not your doctors. That means you need to take ownership. If you see a urologist and they prescribe something, make sure your primary care doctor knows. If your psychiatrist adjusts your antidepressant, tell your urologist. Don't assume they'll communicate automatically. In many cases, if I refer a patient to another specialist, we'll exchange notes or even get on the phone to discuss the case. But that's not guaranteed, especially if we don't know each other or aren't in the same system. Here's what you can do. First, get copies of all your medical records. You have a legal right to them. Most doctors now use patient portals where you can access visit notes, test results, and prescriptions. Download them, print them, keep them organized. When you see a new doctor, bring those records with you. Say, here's what my other doctor found. Here's what we tried. Here's what worked and what didn't. That gives the new doctor context and prevents you from repeating tests or starting from scratch. Your primary care doctor should act as a quarterback too, helping coordinate referrals and making sure everyone is on the same page. But ultimately, you're the one who needs to make sure that's happening. One more tip. If you're in a healthcare system, like the VA or Kaiser or a university hospital, stay within that system when possible. Doctors in the same system can see each other's notes, message each other easily, and coordinate care much faster than if you're bouncing between independent practices. Communication saves time, money, and frustration. And in sexual health, where physical and psychological factors overlap, good communication between your doctors can be the difference between solving the problem or spinning your wheels for months. All right, let's bring this home. Does hardness really matter? Technically, as long as you're grade 2 or above, hard enough for penetration, you're functional. But function isn't the same as satisfaction. And satisfaction is what actually matters. If you and your partner are both happy, if intimacy feels connected and enjoyable, then a grade 3 erection is plenty. You don't need to chase grade 4 perfection unless it's affecting your confidence or your relationship. But if you're noticing a decline, if erections are softer, less reliable, or taking longer to achieve, don't ignore it. This isn't just about sex. It's about your overall health. Blood flow issues show up in the penis first because the arteries there are smaller. If circulation is struggling there, it's likely struggling elsewhere too. So what should you do? Start by talking to your doctor. Be honest. Describe what you're noticing. Use terms like not as firm as it used to be, or hard enough but not completely rigid. Those descriptions help your doctor understand where you fall on the scale. Get your testosterone checked. Low testosterone is one of the most common and most treatable causes of erectile decline. If it's low, Treatment can restore not just erections, but energy, muscle mass, and mental clarity. Look at your medications. If you're on antidepressants, blood pressure meds, or anything else that could affect sexual function, ask your doctor if there are alternatives. And don't underestimate the psychological component. Stress, anxiety, and performance worry create a cycle that's hard to break alone. A good therapist who specializes in sexual health can help you get out of your head and back into the moment. Finally, remember this: hardness isn't everything. Connection, confidence, and being present with your partner matter far more than a technical score. But if softer erections are bothering you, that's reason enough to address it. This is Dr. Victoria Lee reminding you that your sexual health is part of your overall health. Take it seriously, advocate for yourself, and don't settle for good enough if you want better. Stay strong, gentlemen. If this helped, hit subscribe for more real talk about men's health, and drop a comment. Have you noticed changes in firmness? How did you handle it? Your experience might help another guy take that first step.